Lauren, for the introduction. Apologies, everyone. I'm not going to put my camera on because my reception is very poor. And if I do freeze, then we do have a plan. So I will try and get back as quickly as possible. I never know when I freeze, so do let me know if I do freeze or if you can't hear me, Lauren, because I will hear you. Okay, so let's get started. So yes, morning everyone, I'm Fumi Worrell. I'm the Public Health Service Lead for Health Protection, and today the focus for this webinar will be childhood immunisations. I'm just going to start with a few generic slides that you might have already seen, which explains why we're doing this, and then we'll get on to childhood immunisations and vaccinations. So, impact and outcome measurements, of course, should be a key part of any intervention. And that's because measuring the impact of what we do does help to demonstrate that what we're doing is making a difference. And it helps to demonstrate that an intervention is having an impact in a measurable way, rather than just using stories or anecdotal evidence. So we use the standard tools to allow us to compare different interventions' impact, and then combining the standard measures with standard questions on people's identity also helps us to understand if the different interventions are effective for different groups. And we combine these with information on the cost of an intervention and the numbers of users, and we can therefore then look at cost effectiveness. And this is something that happens, all the time in, for example, the pharmaceutical industry when the new drug is being developed, using those measurements of impact and outcome to see if it makes a true and beneficial difference. So without clear impact and outcome measurements, it's difficult to support funding for interventions or to justify the approach that's being used and whether it should be continued or scaled up. So our public health measurement toolbox is being developed to standardise impact and outcome measures for interventions that are trying to improve the health and well-being of our citizens across Birmingham. The toolbox supports organisations when they're developing projects to build the appropriate measures into their service design, and it provides clarity and transparency on how to clearly assess and measure the changes which can be demonstrated clearly when applying for funding. And it allows for accurate and meaningful comparisons between different programmes and interventions, and it helps inform decision making. So this toolbox that we are developing is looking at a set of resources to support measurements related to different areas of health and well-being. So it includes, but is not limited to, physical activity, smoking, mental well-being, high blood pressure and hypertension, long-acting reversible contraception, HIV and hepatitis risk reduction, and of course for today, immunisation and vaccination. So for each section, there will be a description of the issues or the topic that we're talking about, links for local and national information on the issues or the topic, a description of the tool itself, information on any registration requirements to use the tools, useful links to support behaviour change and evidence-based interventions related to each topic or issue, and a case study example of using the tool in practice. So onwards to today's webinar, which will be a focus on childhood immunisations and vaccinations. So firstly, what's the difference between vaccination and immunisation? Well, vaccination is the actual act of getting a vaccine. It's usually an injection into your body parts. It could be your arms or your legs. And immunisation is becoming immune or resistant to a disease. And in this context, you become immune through vaccination. So what are immunisations? Well, the WHO states that the two public health interventions that have had the greatest impact on the world's health are firstly clean water and secondly vaccinations. Vaccines prevent 3.5 to 5 million deaths every year from diseases like diphtheria, tetanus, pertussis or whooping cough, influenza or flu, and measles. Vaccines reduce the risk of getting seriously unwell or even dying from a disease by working with your body to build its own natural defenses. So how do vaccines protect the community? So we have a couple of diagrams here that explains what happens through vaccination. So the first one looks at when no one is vaccinated, and you can see that a disease will spread quite easily through a population. However, when you get a large proportion of the population that's vaccinated, and at 95%, this is called herd immunity, then the spread of the disease can then be controlled. And really quite importantly, it also highlights that those who can't be vaccinated can also be protected when we have herd immunity. So on to the childhood immunisations. So here we have two boxes that describe the NHS immunisation schedule. And you can see that immunisations start from when a baby is 8 weeks or 2 months old. And then they get the next vaccination when they're 12 weeks or 3 months old, and then 16 weeks or 4 months old, all the way up to when they become 14 years of age. And each vaccination is listed there according to the age at which they receive the vaccine. So the NHS immunisation programme is there that describes what the routine immunisation schedule is. And it's there for children aged from 8 weeks old to 14 years. And it protects children from many serious and potentially deadly diseases. So we aim for that 95% uptake or herd immunity of childhood immunisations to make sure that everybody is kept safe. To give you some national context and talking specifically about MMR or MMR vaccination, just to highlight that MMR dose 1 should be given when a child reaches 1 year old. So the data show us that in 2022-23, only 92.5% of 5-year-olds in England have had their first dose of MMR. So of course, this is lower than the 95% herd immunity that we're trying to achieve. And the data also show us that this number is decreasing year by year. And the WHO has described this as vaccine fatigue, and they've directly linked it to the COVID pandemic and people being tired of talking about and receiving vaccinations. In the local context, it's a little bit more alarming because Birmingham has a lower uptake than national. So there's only 88.1% of 5-year-olds in the year of 2022-2023 that had an MMR dose 1. And measles is currently circulating in Birmingham, so it becomes an increasingly urgent priority to make sure that we get an increase in the uptake of vaccinations so that we can protect our children and residents. So onwards to the childhood immunisation toolkit itself. So what it is a childhood immunisation checklist, which just lists the age of the child, right from the first vaccinations at 8 weeks old, all the way through to 14 years old. Then it describes which diseases are protected against. So the first one at 8 weeks old is what we call the 6-in-1, and it protects against those 6 diseases listed there. And then you have the vaccine name, the usual site of the injection. So it could be the thigh or the arm, and some of the vaccinations are oral and given by mouth. And then right at the end, you have a column that says vaccine has been received. And that would be the most important bit here so that we can ascertain whether the child has had the complete vaccination schedule or whether there are any gaps. So what does the toolkit measure? So it helps to identify gaps in the routine childhood immunization program. It identifies whether the parent, guardian, or carer has an awareness and understanding of the child's personal immunization record. And it tells us whether vaccine preventable diseases that the child may or may not have been protected against. So this will allow the professionals to have open conversations about the reasons for not vaccinating children and to design interventions around those reasons. So one live issue at the moment is that some people believe that they can't give their children MMR vaccination to protect against measles because it contains animal or pork products. And in fact, we do have MMR vaccinations that don't contain those products at all, and they're very safe to be given in every faith in every population. So that's a conversation that could be had to address those kind of barriers. And then it allows professionals to provide vaccine-related resources when responding to actual community need. So here's the measurement tool, the childhood vaccination checklist tool. So you've got the checklist that lists all the doses of the childhood vaccination from the UK's NHS routine immunisation programme. The 17 immunisations are listed for the 8 age groups from when the child starts from 8 weeks old all the way up to 14 years. The cost is not applicable because it's all free at the point of service with the NHS. The use would be to have it as a checklist, and the frequency would be pre and post intervention. So before the intervention, you should have an awareness of what the uptake is, and then you have the intervention, and then afterwards you would see whether there's been an increase in vaccination. And of course, that would be the ambition, to increase the number or proportion of children with completed vaccination schedule appropriate for their age. And I think the goal, the what looks good is always trying to get to that 95% herd immunity. And then we have benchmark data which tell us what the uptake rates are. So users can complete the tool on their own if they wish, or you can work with the checklist with them, the provider can. And you may need to support the user with recognizing each of the vaccinations listed in the checklist. And you may need to support users with contacting their GP practice if they're not sure what vaccinations have been given. So we have 3 specific risks and issues that we would highlight for consideration. The first thing being that parents, guardians, carers might not have access to the child's red book, or they might have lost it or misplaced it. Again, there might be issues with accessing medical records if parents and guardians cannot fill the checklist. And also a key issue might be if the parents, guardians, or carers have a negative attitude towards vaccinations. And as I mentioned earlier, it would be really important to clarify what the concerns might be, because we might be able to address them. So how to report the findings. The checklist aims to increase awareness and understanding of an individual's personal immunisation record, and you may wish to collect the data from completed checklists on an Excel sheet or Word document, or however works best for you. So this is a hypothetical case study of how to work through this with childhood vaccinations. So the issue is that the voluntary organisation works with looked after children or children in deprived households or the families of these children. And the organisation is aware that children may have not had some or all of their childhood vaccinations, immunisations. So the aim is to deliver a childhood immunisation intervention to increase uptake of vaccinations. So the intervention is that the service users are asked to or supported to complete the childhood immunisation checklist. The organisation offers basic information, training and support on immunisation to boost awareness and confidence in collaboration with healthcare professionals. And the checklist is completed after the intervention. So findings would be that the voluntary organisation demonstrates that uptake of childhood immunisation has increased via this intervention, and the increased protection against vaccine-preventable diseases has been achieved, and use the findings to work with local healthcare professionals to increase immunisation uptake in the required population. The final slide just looks at the additional links and useful information. So you've got the UK childhood immunisation schedule. You've got cover data, which tells you what the uptake is for vaccinations. And you've got those other useful links listed there. So I'm happy to take any questions about the tool, and I'm going to stop